So the patients that we treat generally arrive at RIGS because they have proved resistant to more mainstream treatments. So often they will have had multiple therapies, multiple analyses, multiple medication trials. And one of the reasons it doesn't work is because they're actually very complex and comorbid. Our average patient has 6.5 diagnoses by research criteria, usually with significant character disorder in that mix. Maybe the most common comorbidity would be something in cluster B with major depression, substance abuse, anxiety, maybe PTSD, something like that. And I will say too, more than half of our patients have made at least one medically serious suicide attempt. And so in a sense, they're alive by accident. And they come here to this completely open setting where we treat them. There are some patients who don't fit that description, who've come here simply because they've heard the reputation of Austin RIGS and are looking for the best treatment they can find. So you can get a range. And at times a question has come up from the outside of whether our fellows are adequately prepared to treat more high-functioning patients. So we were curious about this. So in the past year or two, we reached out to former fellows going back, I guess 5 decades worth of fellows, and asked them that question about whether they felt the fellowship had prepared them to treat more high-functioning neurotics. And it was very clear to our former fellows that the preparation they got for working with more complex patients easily prepared them as well to work with patients who are somewhat less complex or higher functioning.